Well, next up here on Newsmaker, St. James CEO Bryan ODonovan. Bryan, thank you for joining us.
My pleasure.
Bryan ODonovan, things are calming down with the situation with the COVID-19. The Steuben County Public Health Nurse put out a statement yesterday saying that they were very pleased that there's less cases and there were no new cases. No COVID-19 new cases yesterday, which is, I would say, great news for the Hornell community and for all of Steuben County.
Yeah, absolutely. Hopefully, with this positive and encouraging news, and obviously the local community has really embraced these social distancing guidelines and universal masking, that we're able to move on to phase 2, and that's very encouraging.
Yeah, I think so. I don't want to say it would be a shock for the new St. James employees, doctors, staff, and all the workers not to be dealing with so much COVID, but that's all that you dealt with. Well, I can't say it's all you dealt with, but that's, I would say, I think I'm pretty safe to say the majority of what you've dealt with since things kicked in. Bryan ODonovan, how long do you think that the situation will go on with social distancing at the new St. James and the wearing of the COVID face mask? Do you have a sense from the state health department on how long that's supposed to continue?
At this point, I would say indefinitely. Patient and staff safety is always number one, without a doubt. Bryan, until a vaccine is approved through the FDA and mass distributed, it's an indefinite situation.
Sure thing. Talking now with St. James CEO Bryan ODonovan. Sometimes we have on Dr. John Robshaw from the emergency room and Dr. Isabel Mayer from the anesthesiology department, both at the New St. James. One of the nice things about when they don't show up is that we can compliment them a lot. I don't want to embarrass them when they're on, but those two are really super doctors. You don't have to go too far in Hornell or talk to a whole lot of people. If you bring those to find that if you bring those two names up, you get a lot of positive response from the Hornell community on the great experiences that they or someone in their family had going into the ER or having to have a surgery or an emergency surgery.
Yeah, what I think of when I think of these two physicians is, not only that they've been here for years and years, but they've earned the respect of the community, and I think that's probably one of the most important pieces of it. Is a lot of it is earned through dealing with very challenging situations, and working shoulder to shoulder with Dr. Mayer specifically over this. Sometimes you see the best and sometimes you see the worst in people when these issues come up and these challenges. And Dr. Mayer, 1 a.m, 3 a.m, just working constantly, intubating patients, taking care of our COVID-positive patients with our hospitalists. Dr. Robshaw, the exact same thing, and he's always just been a very important constant. And you need to have medical staff leaders. We have a lot of new medical staff, coming from the U of R and other places, and it's just so important to be able to have these leaders in this institution to be able to lead by example. And I can never tell you, I couldn't quantify the importance of both of these physicians and their commitment to this organization and the community.
Yes, I mean, I could go on at length about the different relatives in my family who've been saved in the ER by Dr. John Robshaw and helped out enormously in surgical situations from your anesthesiologist, Dr. Isabel Mayer. And like I said, a lot of people can tell you the same. You have that new ear, nose, and throat doctor who starts up, when will it be, June the 1st. How do we say his name? Is it, well, you do it.
Sure. It's Dr. Mamakoglu.
Okay, that's easy enough.
Yep.
Dr. Mamakoglu, he'll be doing ear, nose, and throat for both children and adults. and he's going to have clinic in Hornell and Wellsville and do surgical procedures at both hospitals. How's things been going with the new doctor here in this transition period as he gets ready to officially open up there, Bryan ODonovan?
Yeah, I mean, I'd like to actually talk about all the services, and as
Sure.
we've spoken before, over the last 2 years, we've recruited 18 new physicians in collaboration with the U of R for many of them, and it's been really exciting for me to be able to open up services that Hornell has not had, but also reinforce other, like our hospitalist program, building a new hospitalist program, and then also providing Dr. Rob Shaw with emergency medicine trained physicians. And I think this is probably one of the most important elements is building a team, not only medical staff, but a leadership team. And that's been one of certainly the most satisfying things throughout my tenure is to watch the growth of the services we provide, but also the collaboration internally of not working in silo, but all working in unison and rowing in the same direction as an organization. So it's really been a lot of fun to watch this grow. A lot of work, but a lot of fun to watch this come to fruition. And with the new building, we've got a lot of positives happening now at St. James. So.
Yeah, and when you go and talk to the workers at the new St. James or at the medical office building, they'll all say, you say to them, what do you like better about the new building? And they all say the space. It's so much more room to work in, and everybody pretty much agrees on that. As far as the old equipment being brought over and the new equipment, how's that situation there, Bryan ODonovan?
Yeah, so Brian, what we've done, I would say probably 90%, all of our imaging equipment is brand new. What we did bring over, we had purchased prior some clinical monitoring equipment for the inpatient floor. So we did bring some of that over. That was about a year old. We bought it prior to moving in because it was certainly a need. And then a couple of other things that we brought over. We have previously spoken about the vent issue, right, that we had a couple of months ago. And so we were going to trade that and donate that equipment. We ended up keeping all of our vents for obvious reasons. And so we brought over, I believe, 7 ventilators. And we're holding on to those until we are completely through this COVID pandemic.
I'm glad you brought that point up. That's very interesting. Bryan ODonovan, CEO at St. James. As far as resuming the regular procedures there, you're resuming them at the new hospital. So everything is being done for the first time at the new hospital. By old and new employees alike, I guess I'd say. How's that transition been as you get back into things calming down with COVID-19 and getting things running normally at the new hospital, Bryan ODonovan?
Yeah, so in terms of the OR, I can tell you last week, which is obviously very exciting, was we actually we had all block utilization full based on pre-COVID volumes. So we hit our pre-COVID budget numbers, which is really fantastic. Because if you think about it, Brian, during the peak of COVID, until we could start electives, we were down to 8% of our pre-COVID budgeted volumes. So to be able to hit 100% a month after, is just it's very encouraging, and I'm certainly optimistic about where we're going. In terms of our team, it's led by Dr. Mayer. It's led by Deb Spratt, our OR RN, and our team is just stellar. We have lots of experience, and so have been able to adapt very quickly and acclimate to their new space and make sure that we're seeing patients in a very timely manner. And our surgeons have done a fantastic job as well with adapting to the new environment. And really just great feedback from the ORs. It's very different from where we came from.
Bryan ODonovan, CEO at St. James, down to the last 60 seconds or so. Any final thoughts?
My final thoughts are, looking at the numbers from positive COVID tests to where we were 2 months ago. I'm just really encouraged, and would definitely would like to see our community, who's done a great job thus far with social distancing, universal masking. I mean, that's the way that we continue on to phase 2, 3, and 4. So, hats off to our community.
Bryan ODonovan, want to thank you so much for calling in, and please stay on the line. It's AM 1480 at WLEA Hornell, and now heard on 106.9 FM. Fox News coming up.